This is a picture that I put together. Asbestos is a mineral. It naturally occurs in the ground. It can be found in multiple locations around the world. The largest producers is Russia at the present time. I think Dr. Castle will be telling you more about where the production occurs, but this is a mineral, and its use is that it can be broken down into small fibers, and these fibers can be woven into fabrics. They can be used to put around insulation and furnaces. They have had, some people have said, over 3,000 different uses. But what happens is these small fibers that you can breathe into your lungs get into our body, and they come through the trachea. We have natural defense mechanisms, and those fibers that are longer than 100 microns, and that's a microscopic measurement, but longer than that will not get into your lungs. It's the small fibers that you cannot see that actually get down into the lungs, and they come and get into the lung. They settle into the alveolar area of the bronchiole, and some of our defense mechanisms are what we call the macrophages. I like to describe them as Pac-Man. They kind of come in and clear out the trash in the lung. And this is a fiber embedded in a macrophage. The ones that are so long that they can't get out are going to stay in your lung. And what are they going to do? First, they're going to cause scarring in the lung. Generally, asbestos starts in the lower lobes of the lung. And this scarring makes it very difficult to breathe. And we can develop a disease called asbestosis. It's a non-cancerous disease, but it can be fatal. And then we have lung cancer, and we know that people that breathe in and have the disease asbestosis are much more susceptible to lung cancer. And those that smoke cigarettes and are exposed to asbestos, they have a synergistic. In other words, it's a multiple effect. A cigarette smoker will have a risk of about 9 to 10 times developing lung cancer. An asbestos-exposed person will have about 5 times greater. But when you combine the two together, it goes up to over 50 times greater. So it's a very strong synergistic effect. The next disease that I want to discuss is mesothelioma. Probably all of you have heard of mesothelioma because there are many law firms that advertise it on TV all the time. And what happens in mesothelioma is that the tumor gets outside the lung, gets out here into the pleura. We have two little membranes around our pleura that act as the cushion for our lungs and allow us to breathe in and out. And the tumor, these fibers get into that area and cause scarring to begin with, and eventually this will damage the cells and the cancer will start. And what happens is you get a condition where this is a lung, and this is black part is the lung here. This is the tumor that grows around the lung, and what happens, it just keeps squeezing and squeezing and squeezing until you can't breathe anymore. This can also happen around the peritoneal area, or the lining of one's stomach, but it's less rare. The problem we have today is that we have a pandemic. That is, it is occurring all over the world, not just in the United States, but throughout the world. And unfortunately, like cigarettes, many of the asbestos companies are targeting developing countries that don't have laws and regulations to protect their citizens in health and safety issues. And so the pandemic flu that you saw, and a few years ago, we had about 14,000 deaths Well, every year, according to the World Health Organization, we have at least 107,000 deaths, and this probably is an underestimate. In the United States, we have about 10 to 12,000 deaths every year, and this is probably an underestimate also. Next slide. This is the disease asbestosis, the first one I showed you. Every year, unlike other respiratory diseases caused by dust and fibers, this is still continuing to go up and up and up. Next slide. And the last slide is just to show you how serious asbestos is. Asbestos is on the top of the list for the Environmental Protection Agency's index of bad acting substances, I like to call it. And you can see, known carcinogen, the next, it's 1 million times, and next you have benzodine, which is about half that. So we're talking about a very serious disease, and unfortunately it has not been banned in the United States. Some 55 countries around the world, including all of Europe, have banned the use of asbestos, but not in this country. And we appeal to you that maybe you can help us in this area. Dr. Castleman, who will follow me,